So my grandmother inspired me to pursue a career in nursing. She was a nurse as well at Diagnostic Hospital that's now closed, and she was an LVN. And so she inspired me to get an advanced degree, which was an RN in her time. And that's what got me into nursing.
After speaking to one of my best friends, and I had told her, I think I'm going to be a nurse. I think I want to go that way. She told me, she said, I think you would be amazing because you've always taken care of other people. A few years later, my father passed away in Venezuela, and I had not gotten into nursing school. It's just something I had thought about. And I didn't quite know how to do and what to do and why things were happening, but I was wanting to learn. So after that experience, I said, no, this is what I'm going to do.
After 20 years of being in the Navy, there were two populations that I wanted to work with. One was either pediatrics, or the other one was working with veterans. So right around the time that I was getting ready to retire, my granddaughter was diagnosed with neuroblastoma. It's an aggressive type of cancer. I spent a lot of time at the hospital. So that's where I found the passion to start working for pediatrics.
So I not only take care of one patient, I take care of the mother-baby dyad and also daddy. When I finish helping a mother with the breastfeeding and education and that mom and baby have that bonding and the smile they have it for me, that is what is my job satisfaction. I always tell my patients, your smile makes me smile.
Houston Methodist as a system is amazing. It's one of the best hospitals I've ever worked for. They really care for their employees, and therefore their employees can really care for their patients. My team is amazing in that they have fantastic teamwork. They're great people all around. There's so many different personalities there, and they all have something different to bring to the table, and we all work very well together.
As interested in learning as I still am, and I've been a nurse for 35 years, and we're still doing new procedures, and I find that my team is so willing to, be part of it. And if they haven't been part of it, because, you can only have so many people in a room, they're like, I want to do it next time with you. It's just a great, great place to work.
I have an amazing team. Everyone is pretty much hands-on. We're willing to do whatever we need to do to get the students to the next level, even if it means going 2 extra miles, not just the extra mile. So for me, it's the team, it's the dynamic of the team, and the willingness that everyone has.
We are there regardless of patients' ability to pay and training the next generation. And those are like the two things that really get me up and motivate me in the morning. We're there for them to make sure that they get the care they need and to see if there are resources available for patients, and then also to develop new nurses going into this nursing career that is really evolving and changing and getting more technological and things like that. And so being there to support them in our medical team.
I have an amazing group of surgeons and providers, advanced practice providers I work with. I work with a great ICU team. We take care of a lot of really sick children, and people come from all over the world for neurosurgery. Really, seeing the kids get better, coming to us, we surgically help them, seeing them get up, move, and just do really well when every odd was stacked against them.
Being able to bring patients back from their sickest moment to seeing them walk out is the best feeling in the world to me. And being able to give their loved ones their loved one back.
Part of our training is to listen, to really sit with a patient, to have patience with patients. But also, even as a researcher, I work with the community. So I work closely with the community of people who are impacted by HIV. I don't just decide to do my research study on my own and publish those results. I'm working with community members. They're publishing papers with me. They're giving me ideas. They're telling me what they care about. So it's really working collectively and collaboratively with the people who are impacted by the work that you do.
I entreat them with, first of all, respect, and second of all, to let them understand that I understand what they're going through. So I sit down and get on eye level with them and talk to them so that they can understand I'm here to help. So I think that builds a strong rapport with patients.
They become like family to us. A couple of times I've had the luxury of being able to place something called a Passamere valve on a trached patient for the first time. And that's what gives them the ability with the tracheostomy to speak and for their family to hear their voice. And then a lot of times it's been months since that has happened. It's the most amazing thing to give something back like that to someone. Being able to advocate and be their voice when they don't have one, but also to give them their voice back. There's nothing like it in the world.
Soft skills. Overwhelmingly, what I need from my team is soft skills. A lot of times it's not what you're telling the patients, it's how you're telling the patients. Even if they ask me something that's outside of my scope of practice. I like that even though we can't always answer everything for them, a lot of times it's still guiding them and just help reassuring, like, this is a normal process, and take a deep breath, like you're doing good.
I've worked almost in every aspect of nursing, except for inside the OR room, pediatrics, and delivering babies. And I can tell you, I started off in the cardiac ICU, and cancer was probably one of the most challenging, most rewarding area that I've ever worked in, because you see people fighting. They're literally fighting for their lives, and they just want to live.
Nursing is service-driven, the most trusted profession.
It's something that gives us energy, that gives us joy.
One of the hardest and most rewarding jobs that you can have.